Can you explain to me how neuropsychology and stress are related?
Well, neuropsychology is basically the scientific study of the mind-body connection. You know, it's not this ethereal, voodoo, foo-foo thing. I mean, it's a branch of science, basically. And the neuropsychologist tries to equate psychology or psychological processes and abnormalities to biological and physiological processes, that the two are linked and one doesn't exist without the other.
So we're really bridging that gap with the mind-body connection.
Yeah, absolutely. I mean, this is a prime example of past meeting present and East meeting West, because for thousands of years, many cultures have talked about the mind-body connection and how if you think it, therefore it can become reality. I mean, everything in this room started off in someone's mind, basically, and became physical matter. So the mind is the matter.
So since the 1970s, that was 40 years ago, this concept of mindfulness, actually looking at the mind-body connection and how we can use our minds to help ourselves physically, has been around for 40 years?
Absolutely, and there's a lot of empirical data to support the use of mindfulness exercises clinically. And not just clinically, not just for our clients, but for ourselves as clinicians. I mean, in fact, mindfulness is even being taught in some universities as a modality. So again, another example of East meets West, maybe, past meeting present, and moving into the future.
That sounds a lot like cognitive behavioral therapy to me, where we identify what the thought is, and then we look at how that creates feelings and leads to behaviors. So identifying the thought is part of mindfulness.
Well, I think, therefore I am. And mindfulness is exactly that. I think, therefore I am. But it's beyond that in a way that you don't have to be married to your thoughts. You can acknowledge your thoughts, but they don't necessarily have to cause you to action. And learning to do that, learning to disengage ourselves, perhaps, or take a step back and be an observer of our thoughts as opposed to being directly influenced by them, takes a little bit of practice.
So if I wake up in the morning and spill my glass of milk and say, "Oh, I am such an idiot, what did I do? I am going to have this horrible day."
Well, in your case, that's probably true,
but
your cup is either half full or is it half empty? You know, and that's really the key, is how do you look at it? It's the same glass of water, but some people look at it and say half full. Some people look at it and say half empty. You know, and so mindfulness helps us to perhaps disengage ourselves from the half full or the half empty. It's merely a thought. I don't have to pass judgment on it, and I don't have to own it. Thoughts are transient. They come and go. We're the ones that latch onto them and give them power or not.
So it doesn't matter whether I think that spilling the milk was bad or good. I don't have to think of it as anything but just what it is.
Spilt milk.
It's spilt milk.
And let's not cry about spilt milk. So we don't have to be slaves to our thoughts. We don't have to be slaves to our emotions. To a certain extent, we have some choice and we have some control. And learning these mindfulness exercises can help us gain that control.
It seems a little difficult. We're taught to use our thoughts and to think and to feel in this field. And so to tell me I have to stop thinking, I have to step back and not pay attention to my thoughts, but not react to them, it could be a challenge.
Well, and it's not necessarily that extreme, but perhaps not react to them immediately. Just taking a moment to decide what you're going to do next. Because, again, we can be adversely affected by our thoughts, we can be adversely affected by our emotions, and when we're in a chronic state of stress, those thoughts and emotions can be skewed. And so until we learn to recognize that and do things to counteract that, we may not make the best decisions.
Pretty exciting that there's research to support the idea that mindfulness can help, and not just in physiological symptoms and signs like heart problems, but pain, depression, anxiety. I mean, this covers an awful lot of behavioral health and physical health, and the research is supporting that. Mindfulness research.
Yeah, the empirical data is there to support it. So it's not just an esoteric practice, and I'm not saying that it's not an esoteric practice, but it's not just an esoteric practice because there's empirical data to support its use clinically on any number of behavioral health, mental health issues.
Because I know a lot of new fads come out. There are new trendy kinds of treatments and self-help books that come out that proclaim to fix everything. Well, this sounds different. It sounds like they're doing research, evidence-based research, to support this idea.
Well, Kirsten, the application of mindfulness has been around for thousands of years, so I don't think it's a fad.
So going to the sea, listening to the ocean, these are things that they used to say in the past were treatment options. I want my doctor to say that.
Well, thank God we're in Maui right now because we can do that. But the idea is that this is another example of science coming full circle, because in the past, your emotions and your passions, so to speak, were linked to your health, whether you were healthy or you were ill. If the passions and the emotions were properly balanced, then you were healthy. If the passions and the emotions were out of balance, it could cause disease. And now science is saying similar things, that there is a link between how we think and how we feel emotionally is going to affect us physically as well.
So somebody with diabetes can control some of their glucose levels, their sugar levels, by practicing mindfulness?
And deep breathing exercises, and that's what we've been talking about. If you can control your breathing, you can control a lot of physiological and psychological responses that occur to us naturally. Without that control, they can become harmful, maybe detrimental to our health and our overall psychological and our emotional well-being. But with the tools in place to mitigate some of these existing factors or the existing pitfalls of our profession, then we don't have to suffer these things. We can make them less likely.
Well, it does make some sense. We talked earlier about the physiology of stress, and we talked about how when you become stressed, your body actually changes the way that it processes glucose to get ready for fight or flight. So if we're able to mitigate some of that stress, it makes sense. It makes scientific sense that we would be able to affect how our body deals with glucose for diabetes or heart problems or any other number of physical conditions.
Yeah, and these are all stress-related diseases. So again, if we can mitigate that stress, if we can control that stress, if we can alleviate the pressures of some of that stress in its chronic form, then we can perhaps escape some of these very common diseases in our society.